Hello everyone, welcome to Patient Knowledge. I'm Dr. Kirmani and today I'll give you an overview about peptic ulcer disease. So let's get started. What is peptic ulcer disease? It's a disruption or a break in the lining of the gut. Peptic ulcer disease can occur in the stomach or the duodenum. When it occurs in the stomach, it's called as gastric ulcer. And when it happens in the duodenum, it's called as duodenal ulcer. So for a better understanding, let's have a look at this picture. As you can see, there is the food pipe or the esophagus that leads into the stomach. But the stomach goes into the next part of the gut called the duodenum. This is lined by a slimy mucosal layer which protects against the acid that is produced by the stomach. The stomach produces the gastric juice which helps in digestion as well as acids that also help in digestion of the food. So how does this ulcer develop? Stomach produces gastric enzymes or chemicals and acid. This helps in digestion. This acid is produced by the cells in the stomach and it's strong enough to burn the skin. However, our gut is protected by a slimy mucosal layer that runs throughout the entire length of the gut. The mucosal layer gets disrupted or it breaks due to two main reasons. One is excessive production of acid by the cells in the stomach, and two is due to infection by an organism called Helicobacter pylori. Now, who is likely to develop peptic ulcer? People who smoke heavily, those who are heavy drinkers, people who have constant stress and anxiety, people who are on long-term use of strong medications that affect the mucosa of the gut, such as aspirin, cortisone, and painkillers like NSAIDs, and it's more common in young to middle-aged men. Now, the symptoms and complaints. People with peptic ulcer disease mostly complain of pain. This pain is related to food and it is present typically in the upper part of the abdomen. It is related to food. In gastric ulcer, the pain starts after taking meals, whereas in duodenal ulcer, pain is relieved after taking food. The heartburn or indigestion is another complaint experienced by these people. Pain is relieved by antacids and milk, whereas back pain is a rare complaint and bleeding is also very rare. There could be bleeding in the vomiting or passing some blood in the stools. These two are rare conditions, and if it happens, it is a sign of complications. Now you must be wondering, how is it diagnosed? If you have hunger pains or severe reflux, see your doctor. Your doctor will assess you and will refer you to the gastroenterologist. Now the specialist will perform some investigations to confirm the diagnosis, such as gastroscopy, which is used to visualize the gut. A tube is passed through the stomach. It has got a telescope and lights at one end, and this helps to see the entire gut. It can detect any ulcers or if there is any swelling or inflammation of the gut. This can also be seen clearly. The other test is called H. pylori test or the breath test. This will confirm the diagnosis of an infection in the gut as being the cause of the ulcer. Now, what are the risks and complications of peptic ulcer disease? Bleeding, which is the most common complication. So one may vomit blood or pass it in the stools. Perforation, which means a hole in the gut and the stomach contents may leak into the abdomen due to the hole, and this can cause infection, and this condition is called as peritonitis. Obstruction. This is also one of the complications of peptic ulcer disease. Now, after the ulcer heals, it can cause narrowing to the stomach outlet, and this can lead to obstruction. Treatment. So the good news is it can be treated by self-management and with the help of medications. Self-management includes some lifestyle modifications which can be done easily, such as stop smoking, reduce alcohol intake, practice yoga and meditation to relieve stress and anxiety, and avoid NSAIDs, aspirin, or cortisone. You need to review with your doctor for change of medication. Take 3 regular meals and 2 snacks, and always eat healthy, balanced diet, and avoid skipping any meals. Now, antacids can be taken to relieve the symptoms. All these measures will help because these are the trigger factors. So if you avoid them, this will help heal the ulcers. In addition to that, medicines will definitely help by reducing the acid production and by treating the infection. So proton pump inhibitors is a group of medicines available. They can be taken in the form of tablets. They have to be taken for 3 to 6 months. This helps by reducing the acid production. And triple therapy is a combination of antibiotics. This is to be given or taken by people who are found to have the H. pylori infection. Well, if these measures help, then complications are minimized, and not everybody who has peptic ulcer disease develop those severe complications. And just in case if anybody develops, there's a surgery that can be done to treat these complications. Now that comes to the end of my video. I hope it was useful, and thanks for listening. If you like this video, like and subscribe to my channel, and every week I'll come with some videos related to health conditions. So if you're interested to know about any conditions, leave it in the comment box below. Bye for now.